another compelling edition of Health Check, the program where we break down the health issues shaping our lives, one honest conversation at a time, right here on Voice of the People Television. I'm Praise Peters, and as always, I'm delighted to guide you on this journey into clarity, awareness, and healthier living. But remember that you can watch us live on SLTV channel 264 and stay connected on all social media platforms at VOP TV Live for health tips, updates, and conversations that matter. Now, before we dive in, here's a little something to make you smile. Have you ever told yourself that I'll just eat this small piece of cake or chin chin or peanuts, and before you know it, everything is gone? Well, your blood sugar noticed that, and that's why we're here to talk about diabetes today. So, today we are shining a spotlight on a condition that touches millions of households, yet remains heavily misunderstood. Diabetes. So, to help us separate fear from facts, myth from medical truth, we're joined by two exceptional experts. Dr. Rebecca Markley, a medical doctor and health expert who helps professionals balance health and career through food-based solutions, and Dr. Charles Adiogo, a wellness physician and public health advocate, committed to raising awareness and promoting preventive health strategies in communities. Doctors, thank you so much for joining us. Thank you, Dr. Charles, for joining us.
Thank you. Good afternoon.
All right. Thank you, Dr. Markley, Rebecca, for joining us. It's good to have you here on the show. Thank you so much. So before we get deep into the conversation today, I'd love to start on a personal note. So Dr. Rebecca Markley, what is one simple health habit you practice every day that you want everyone watching to begin immediately?
It simply puts, I'll say, drink water.
Water. Yeah. Very important. I've heard that a lot of times.
First thing
water.
in the morning. Yes. Drink
First
water.
thing in the morning.
Yes.
Oh,
yes.
okay. Why?
And
how
make
does
sure
that help?
throughout the day you've had like 8 cups. Or if you have a big bottle, have like 2. That big bottle should be like 1 liter, 1.5. Have like 2 to 3 of it every day.
So every day we should consume at least 3 liters of water.
2.5 to 3 liters of water.
Okay, our medical expert has spoken. I'm sure we've gotten that. All right, how about you, Dr. Diogo?
Well, for me, I would advise the listeners to have more fruits in your diet. Incorporate more fruits and veggies in your diet. You can't go wrong. Apart from the vitamins, you have the fiber that helps with your digestion. And at least constipation will be out of your way. and you will know.
Okay. What are some of us that don't like eating the fruits, but we just like fruit juice?
Well, the truth is there are different fruits. You know, there are a variety of fruits. So you can always have, you know, your preference in one of those fruits.
Right.
Yeah.
All right. Okay,
you would always like one more than the other.
Okay. I'll try. We will try. All right, let's go deep into the conversation now. So, Dr. Rebecca, I would like to start with you. So what exactly is diabetes and how does it affect the body? Because, you know, some people do say, oh, my sugar is high and all of that. What does that really mean? Just break it down for us.
Okay, so diabetes basically means you have a high level of glucose in the blood. Simply put, layman's language. Now, medically speaking, we have values to back this up. I won't go into that detail here, but we have 2 parameters. We have the random blood glucose level and we have the fasting blood glucose level. Now, for the random blood glucose level, we expect that anybody, even if you've taken a meal, your blood glucose shouldn't go beyond 150. And then for the fasting blood glucose, it shouldn't go beyond 50. Okay, so but once your values go beyond these values, we now proceed to do some other tests and now diagnose this particular person as having a high blood glucose level or having diabetes. Simply put, yes.
All right. Okay, let's go to Dr. Charles. So, Dr. Charles, are there different types of diabetes? And how can the average person understand the difference between type 1, type 2, and gestational diabetes?
Okay, thank you. So diabetes can be classified into type 1, type 2, and gestational diabetes. So type 1 is essentially the insulin-dependent diabetes. in which the problem is actually insulin deficiency. So in type 1 diabetes, it's also referred to as juvenile onset diabetes. So most people that are born with either their pancreas not producing insulin at all, complete deficiency, or they have insufficient amounts of insulin produced, they all fall under type 1 diabetes. While type 2 diabetes, insulin deficiency is not the problem. It is how the body responds to insulin that is the problem. And type 2 is usually associated with obesity. So type 2 is referred to as the non-insulin dependent type of diabetes. And, though insulin is present, the receptors are not responding appropriately to insulin. So you still have elevated sugar in the blood, and it's not getting to the cells where they are normally utilized. The third type of diabetes is referred to as gestational diabetes. As the name implies, it's associated with pregnancy. So in this kind of diabetes, you find a woman who, prior to her pregnancy, her blood sugar had been normal. There was no problem whatsoever. But in the course of pregnancy, she now finds out that her sugar is actually going up, and the levels remain elevated. And in such situations, it poses a lot of potential risk to both the mother and the child, because the child can be born with some congenital problems, meaning some malformations in the child, and then the child can also be bigger than usual, what we call fetal macrosomia. The weight of the child is 4 kilograms and above because of the high circulating blood glucose. So certainly you find out that in gestational diabetes, it's very important that antenatal care, is emphasized, because you can imagine, how would you know your sugar is high if you were not going for antenatal? Exactly. It is during antenatal that, at your periodic visits, you have your blood work, you have your urine checks, and all those things. So that's why we always emphasize that every pregnant woman should always go for proper antenatal check and keep up with your appointments, so that if there's anything, it's going to be picked up early. And then, of course, your dietary and lifestyle changes that you require, they are instituted, and the right management is put in place. You cannot manage these things on your own. And because of the potential risk it has on the unborn child, it may also influence the type of delivery the woman is going to have. So it's very essential that antenatal is made mandatory for every pregnant woman. So it's not by choice, it is actually essential for every pregnant woman. Compulsory, that's the word.
All right, you mentioned something about obesity. Is it possible for a slim person to have diabetes?
Yes, because diabetes, just like most chronic illnesses, there's a huge genetic aspect to it, whereby it runs in families. So whether you're actually on the big side or not, if you have a strong genetic predisposition, you can actually do have diabetes. So though it's very common amongst obese people because of the large fat and the large surface areas, large body surface area. They also have insulin insensitivity. So because their bodies are not so sensitive to insulin, and because of their sedentary lifestyle, in some cases, lack of exercise, and maybe the kind of diet that they normally indulge in, you find out that they are at increased risk of diabetes. But that is not to say people who are also slim cannot have diabetes. And it's also important for us to mention that weight loss can also be a presentation or a presenting symptom of diabetes.
Weight loss?
Yes, weight loss.
Wow.
You find out that the person is losing weight because the glucose is not getting to the cells where they're supposed to be utilized, and it's like starvation in the midst of plenty. You have so much circulating glucose in the blood, but the cells are actually not getting it because insulin that should be at the interface is either deficient or not responding properly.
All right, getting interesting. So let's go to Dr. Rebecca Markley. Doctor, how much of a role does family history play in this? Is it genetic and all of that?
Okay, family history plays a huge role. It plays a huge role. The fact that one or two of your parents have had diabetes plays a major role, and I would explain why. Now, of course, we all know that genes are hereditary and they are passed on. And many times it's not just genes that are passed on, but also if you are in a particular family that has a particular illness and are used to certain habits, there's a tendency, yes, you have those genes, but also you will pick up those same habits, okay? And Of course, if you indulge in the same habits, you already are predisposed to it, you end up with the same illness. So it does play a major role, and that's how it plays a major role. Yes.
All right, all right. So since we're still talking about, genetics and all of that, let's still touch, symptoms and diagnoses of diabetes. So Dr. Rebecca, what early warning signs should people pay attention to? I mean, at what point should someone say, okay, this is not normal anymore, I'm getting too tired, I should get checked and all of that. So at what point should we start paying attention to early warning signs?
Okay, so if one notices that they have frequent urination, especially at night, you are getting
frequent urination at night,
especially at night, 5 times, 6 times, 7 times, 8 times, that's a warning signal. Yes. If they notice all of a sudden they are losing a lot of weight and there's nothing else that they've picked that is wrong with them, that's a warning signal. If they notice that they are thirsty, that's a warning signal. Then for some people, when it has really, really gone far, you may start noticing that, oh, your urine is foamy, But the early signs are usually thirst, frequent urination, weight loss. Also, if you notice that you're always breaking out in boils, you're always having infections, and you're always repeatedly using antibiotics and they don't seem to be going away, it's a sign that you should check your sugar level. Yeah.
All right. Thank you very much, Ma. So let's bring it back to the studio. Dr. Charles, Dr. Rebecca mentioned, weight loss, tiredness, frequent, urination and all of that. Well, some of these symptoms, especially weight loss, can be misinterpreted as stress, if you would agree with me. Once someone is already losing weight, they're like, oh, you're stressing yourself too much, you should rest and all of that. So how can we differentiate between stress and, diabetics symptoms?
Okay. Basically, another important thing to notice is that you may have what we call unintentional weight loss because the person can't understand why they're losing weight. But diabetes also presents with increased appetite. You may be having more hunger pangs. You're always calling for more food.
Isn't this in contrast to...
No, it is not, because like the doctor has said, the triad, actually, you have increased thirst, you have increased urination, and increased appetite. So you can imagine somebody who is eating and within a short interval is asking for more food and more food, but actually losing weight. You see, when you have all this, you just think straight. You need to get your sugar levels checked. And it's important for us to also mention that these are symptoms. So there's a difference between symptoms and complications. Some other people, because of their poor health-seeking habits, they don't go for wellness checks, they don't go for routine checks. So they don't even know that this has been happening to them over a period of time. And things are getting more complicated by, just like the doctor said, they're now having foamy urine that implies that it's beginning to have some renal complications affecting their kidneys. Some people may also now experience, some kind of numbness, tingling in their limbs, pin and needle sensations, blurry vision. This is telling you that this is not just starting now. Complications are already setting in. Some men can have erectile dysfunction. You can have wounds that will not heal on time, that may even lead to amputation of the limbs in some instances. And then you may also have people ultimately also develop some cardiac complications and even increased risk of stroke. So you can see that for a lot of people, before they know sometimes, they don't even pick it up at that point where they are urinating frequently. It's when something more serious, like there's a wound that will not heal. That's when they will now say, oh, maybe they should go and get their sugars checked. And that is even if they are properly guided by a health professional. So the essence of saying all this is sometimes you don't just wait for just the symptoms.
Early detection.
Exactly. By the time you see you're urinating more than usual, which was not before the norm for you, and you also see that you're becoming more, thirstier all the time, you need to make sure that you get your sugars levels checked. And then when you also notice that you're beginning to feel needle sensations or gloves and stocking sensation, you just feel some weird things in your limbs, that is not usual for you, you should always get it checked. And it is not every time a person loses weight that you attribute it to stress. Sometimes it could be diabetes, sometimes it could even be cancer, sometimes it could be hyperthyroidism. There are a lot of conditions that can just make you have unintentional weight loss, unexplainable weight loss. So weight loss without a tangible cause is a red flag that must be thoroughly investigated. So that is how to distinguish it between it and normal stress. If it was just stress, you know that once you take a break, you go on a vacation, you know, and you remove the stressor, you know, everything seems to normalize, but that is not going to be the case if it's diabetes.
All right. So what tests can be used to diagnose this diabetes?
Okay, I think the doctor had mentioned them. You know, you have your fasting blood sugar. That is you checking your blood sugar levels after a period of fasting, usually about 8 to 10 hours of fasting. And then you also have your random blood sugar, which is, and it's important for us to note here that you have a normal reference range of values for each of these tests. So if you're doing a fasting test, there's a normal reference range it's expected to be within. So if you do a random blood sugar, there's also a reference range of value it's supposed to be within for it to be considered normal. Then for people who are confirmed diabetics, you know, when they come for follow-up checks, we now have what we call the glycated hemoglobin, and that helps us to do, to assess or evaluate their control of their blood sugar over a period of time, you know, to know if from their last appointment up till now, how has their sugar been controlled. It helps you know people that are compliant with treatment. It helps you know people who are following their meal plan. And it helps you to know people who are doing well on the current therapy. And it helps to inform the doctor whether he needs to adjust their treatment or adjust the doses of the drugs they're on.
All right. So, Dr. Rebecca Mockley, I'd like to come to you. You are a nutritionist to a very large extent. So I'd love to take this to the diet angle. So how does diet, stress, sleep, all of this, you know, lack of exercises contributes to diabetes, and what lifestyle changes can actually improve the condition?
It's okay. So diet plays a major role. Like I've said first in the definition, that diabetes basically has to do with a high glucose level in the blood, and of course, one of the first ways we get glucose into the system is from what we eat and the process of digestion. Okay. The other way that glucose floods the system is when the body is in what we call a fight or flight mode. In other words, you need to attend to a particular matter, you need to be awake for a bit longer. So your body activates a hormone called cortisol. Cortisol makes sure that your body system is flooded with glucose. The main purpose is that it's trying to help you have enough energy to complete the task at hand. Okay. Now, the fight or flight mode is usually what we experience when we say we are stressed. It means basically that we have to attend to a particular task, and maybe we have a short time or we have little resources, so we are a bit more tense, and usually at that time we need more energy, and that's why cortisol comes in. Now, if you are constantly in that particular situation, that means every time your system has a rush of glucose coming through it, if persistently you are eating meals that have a very high glycemic index. When we say it has a high glycemic index, what we mean is that it has a tendency, when it breaks down, to flood your system with a lot of glucose. Okay, or in simple terms, what we're trying to say is that the basic components of that meal breaks down very easily into glucose, which glucose, as we all know, is sugar. So these are the two ways that stress and diet affects. Then, of course, when you don't sleep, you need to be, and you're trying to be awake, you're trying to be alert. Your brain also needs energy. So it kicks in different mechanisms in your body to make sure that the sugar level is high. So you can imagine you constantly being in all these states for very long periods of time. After some time, of course, the first time it happens, your body's mechanism kicks into place. Insulin tries to do its work, which is basically to transport glucose to the cell and all that. But after some time, in science, many times we say either it becomes production reduces, or it becomes overwhelmed. In other words, the sugar load is too much for it to carry. So I hope in simple terms, everyone has been able to understand how these four things go hand in hand
All right.
to raise sugar levels and ultimately lead to diabetes.
All right, so sugary drinks. What about sugary drinks, alcohol, late night eating?
They're all part of the whole sequely. They're all part of the whole drama. Yes.
All right. Okay, thank you very much, ma. Okay, Dr. Charles Adiogun, let's make this more relatable to the audience. So, what everyday habits put people at risk on a normal day and they don't even realize it? What everyday habits do people just don't, pay attention to, but it is actually putting them at risk to having this particular health condition?
Okay, there are some everyday habits that increases your risk or predisposes you to diabetes. One of which is the sedentary lifestyle. So if you're always seated for a long period of time, or you're somebody that you're an executive and you have people run errands for you.
Remote workers.
Exactly, and remote workers. So everybody is doing the work, running up and down to get your objectives, met, but you are declining in your health quality, so to say. So basically, a sedentary lifestyle is a problem. Then for a lot of people who binge on alcohol, it's also a problem because alcohol has been strongly linked to pancreatitis, which is inflammation of the pancreas where insulin is produced. So you can imagine chronic inflammation of the pancreas will make you, have a decline in pancreatic function. Then, of course, binging on junk foods.
Junks. Oh my God. I feel like this is very relatable.
Or you are eating everything that you crave for, forgetting the nutritional nourishment it brings to you, or the potential detrimental effects it can have on your health. So the fact that you suddenly remember certain snacks, I don't want to mention names here, which we all know, that, okay, you just have a sudden craving for it, and then it's almost on impulse that you just make an order, and then you eat and eat and eat, and you can't even control yourself that, okay, this is how much of it you want to eat. And then you keep ordering and ordering back to back just because it feels good, just because it tastes nice, and then you forget about your health. So you can see diet plays a role, you can see lifestyle plays a role. And then for a lot of people who, for one reason or the other, exercise is not just their thing. They'll just tell you, exercise is not for me. I don't see why I need exercise. I'm already active and all that. Exercise has shown to significantly improve the quality of lives of diabetics and also to reduce the risk for people who have other risk factors in place, like genetics. So for instance, you come from a family that diabetes is very prominent in their lineage, and you try as much as possible to avoid the sedentary lifestyle, you have a consistent exercise routine, you watch your diet closely, you drink alcohol responsibly, you're likely not going to come down with diabetes. So these are just a few of one of the most important everyday things that people do that they are not actually aware increases their chances of diabetes. And of course, people that are obese, you better find a way to manage your weight, because your body weight, has a strong link to diabetes, hypertension, and other cardiovascular events.
All right, it has been a very interesting conversation, but right about now we're going to take a short break, and when we return, we'll dive into treatment options, myths, and how to prevent complications. Please stay with us. All right, it's been a wonderful conversation here. We've been talking about diabetes, and I've been with Dr. Rebecca Markley and Dr. Charles Adiogun. They've been able to establish the causes, the symptoms, the complications, and all of that. So right now we're talking about the treatment. So let's go to Dr. Rebecca first. So Dr. Rebecca, what treatment options are available for diabetes, medications, insulin, and all of that? Can you just brush through once again?
Okay. So first and foremost, because this is my tough, the first thing is always to have to approach it from nutrition. First and foremost, person has to adjust their nutrition depending on the level, because it depends on how long, how bad the symptoms present, and if there are any complications. Then also there are medications that control diabetes, okay? And then in some cases, especially where it's obvious that the pancreas is not producing insulin at all, we augment with insulin injections. So those are basically the three lines of treatment, yes.
All right, all right. So, Dr. Charles, you talked about early detection when you were, talking about the causes and all of that. So, how crucial is early treatment in preventing long-term damages?
Very important because, we try to differentiate between the symptoms and complications. So complications are what result from persistently uncontrolled diabetes. So the problem is not diabetes in itself. The problem is actually leaving it uncontrolled, because there are a lot of people living with diabetes well controlled and they have minimal complications and they have a good quality of life. So it's very important that early diagnosis helps you to institute treatment early, to put in place all the dietary and lifestyle modification, and then ultimately the goal is minimize complications. So what are these complications? We've mentioned blurry vision or even blindness. It's important that we mention that diabetes can make people go blind, can make people lose their vision because of the retinopathy. It can cause renal failure. These are the end stage consequences of persistently, uncontrolled diabetes. So for people that are uncontrolled, they'll have wounds that would not heal, leading to amputation. You can have people having what we call numbness and tingling sensation, the neuropathies. You can have men presenting with erectile dysfunction. You can have increased risk of stroke. You can have increased risk of cardiomyopathy. And then you can ultimately have, of course, death, because people can go into a diabetic coma. So that's something that results when you have hyperglycemia, that is elevated blood sugar over a long period of time, and nothing was done about it, either because the person didn't present early enough, or the person was not compliant with treatment, or the person was, in the case of Nigerians, looking for other alternative treatments that are not effective. And the person has been on these things, and ultimately complications result. So ultimately, the advice to everybody is early detection. Do something about it once the diagnosis has been established. Go for regular health checks and be on your drugs as much as you can. And the doctor has already talked about the treatment modalities available.
All right, so I would like to go to Dr. Rebecca for this particular question, because you are a nutritionist. So, we talk about something we popularly call agbo in our dialect. Okay, so agbo jadi is very, very, very safe according to what people, usually describe it as. So how do you think this can work with medications? Is it better than modern diabetes medications and all of that?
Okay, so thankfully we're in a world where people are, knowledge is increasing every day, and people are doing their research. So, but when it comes to things like diabetes, it's very, very important that whoever you are getting these things from is knowledgeable. Now, let me tell you some dangers about the herbal medications. First and foremost, they are not properly regulated. A few people are coming out to regulate them properly now. Then many people don't know, which some people in my space are trying to raise awareness about this. Some of these preparations are made, they are kept for a long time, mold gets into them, and it's now the offshoot of what was produced that is molding and spoiling is what people are taking, and it can lead to it can damage their kidneys seriously. So it's very, very important that you don't just take anything. Unfortunately, we live in Nigeria especially, people are not don't pay attention to quality. Other parts of the world where they've started taking time to study the herbs, they are doing a lot of quality checks on them. But in this environment, there are very, very few people that pay attention to quality. So I wouldn't advise anybody that already has sugar problems, is already having complications, to just go to anybody. Make sure you go to somebody that is trained, that really understands what they are doing, because you may end up, you are trying to treat the sugar and avoid drugs, but you may not end up with a kidney complication, which we don't want that to happen. And not just the kidney a complication in your kidneys, there are other organs that would be affected, so it's not just wise just to buy anything off the street. How long has that thing been prepared?
Exactly.
Is this actually the herbs or the mold that you are drinking? So all those things matter. And unfortunately too, in our society, people don't really value their health. So some of the people that have actually been trained and understand how these things are supposed to be prepared and used, they are not even willing to go to them. So those are some of the challenges with it. So my first advocacy is that go to the hospital, make sure that you are properly checked, and if this is the route you want to take, go to a certified professional.
Yeah, so modern diabetic medication is still the best.
It's still important.
All right.
It saves a lot of
Dr.
money.
Adegu talked about junk foods and all of that. Please, we know that some of these junk foods are quite, heavy in fat and all of that. So can you recommend some snack that we would safely swap with all of the ones we've been taking to reduce this sugar intake and, reduce the risk of diabetics?
Okay. So, even though my focus is on food and medicine, I would say I am not a dietitian. But from my experience, one of the things that help to calm hunger pangs and also keep your sugar down is having something that is rich in protein. Okay. And we have things like our nuts. Now, I'm not saying take a whole bottle of granuts. No, please don't do that. Or you can have like a handful of cashews. You can have chicken. You can have your meat. Then fruits that are low in sugar, things like watermelon, you can have that. Vegetables like cucumbers, you can have that. So those are things you can snack on. But we all know by the time you eat cucumbers and watermelons, they are basically water-rich fruits. You'll feel hungry. So pair it with a nice protein. It will help.
All right. Thank you very much. Okay, let's come back to the studio. Dr. Charles, so I want us to talk about some myths, right? There are some things that people just misinterpret diabetics to be. So some of them are that only sugar causes diabetics. I don't know if that's true. Some of them say herbal mixtures can cure it. Some of them say diabetes is a spiritual attack. Some of them say only overweight people get diabetic. Some of them say once you start medications, it will not leave completely. It can only leave, just... So can you just clarify some of these myths?
Okay, thank you. So myths, these myths are misconceptions. They come from people not having a thorough understanding of the condition. But basically, it's good for us to emphasize here that diabetes is a chronic metabolic state or condition that cannot be cured. It can only be managed. So it's a lifelong treatment. This is very good for people to make peace with at the beginning so that you won't have problems with compliance to treatment. So when your doctor is always asking you to be on your medications or asking you for regular wellness checks, you would not be saying, for how long am I going to be treating this? You will be clear from the beginning because you fully understand that this is a condition that you would have to manage long term. So that is something people should settle in their minds. That's number one. Then number two, most of the foods you eat, carbohydrate foods, are broken down to sugar by the process of digestion. So every food you eat, your body has a series of processes of breaking them down, extracting the nutrients from them before elimination in your body. So your body absorbs the nutrients ultimately. So most carbohydrate foods are broken down to sugars. So when you are referring to sugar, we're not only referring to that white refined sugar that comes in cube form or granulated form.
Definitely.
Exactly. So people should understand that it is not only that kind of sugar. So if you're eating a lot of your pounded yam, your white rice, your white bread, and all that, and doing all the pastries, yes, you're going to have your sugar spikes, especially if you're already non-diabetic or you are pre-diabetic.
And taking a
Because-
lot of soda.
yeah, or take a lot of sodas, yes. So basically, you know that you are going to actually have a sugar spike. So it's important we know that. And then, of course, most illnesses, if not all, in fact, I would say every illness has an explanation. That is why there is a study called pathology, where you study diseases, because there is a basis for most diseases. So there are some diseases that may not be fully understood, but there is always an explanation for them. So for you to think it's spiritual, completely count that out, because that is just our own African mind trying to explain what seems poorly understood or is mystical to them.
Exactly.
Just because they don't have answers to it or they don't have a thorough knowledge of it, they now assume it has to have a spiritual origin. The truth of the matter is diabetes is explainable. It's a metabolic condition. Either you're not producing enough insulin, or your body is not responding to insulin, or it's gestational. You know, so it has to be one of these factors. And if you do a thorough family history taking, you'll find out that it is somewhere, you know, already in that family line. Then it's also necessary for us to know that, please, like the doctor said, you have treatment options available. These are time-tested and trusted methods of managing diabetes. So we use the word managing, referring to diabetes, hypertension, and some other illnesses, because they don't really go away. So when you say treatment, if you use the word treatment, some people may misinterpret it to mean that, okay, you take the course of treatment for a certain duration of time and then it goes away. This is not the case in diabetes. So you know that it is a constant treatment that entails you taking your medications, modifying your lifestyle, changing your diet to make sure that you maintain, you know, optimal glucose levels. So I hope that answers the question.
Yes, definitely. But earlier you spoke about a type of gestational diabetes that has to do with pregnancies, right? So is it possible that women with gestational diabetes can have healthy pregnancies all through?
Yes, that's the essence of you going for, you know, your antenatal checks and being, you know, monitored by an obstetrician. That's the specialist in charge of pregnancy and pregnancy-related conditions. So once you're already going for your regular checks, your sugar levels will be checked, your HbA1cs will be checked, your urinalysis will be done, we'll check the number of pulses of glucose you have in your urine, because all these are indicators of how well you're doing and how well your sugar is controlled. For a lot of women who have gestational diabetes, yes, they do carry their pregnancy well, and they give birth to babies, you know, that are healthy. But the important thing is that everything must be done under strict scrutiny and monitoring, because that
medical
surveillance is very, very key to minimize your risk of complications. Because you can imagine a woman who has been pregnant and maybe she's had previous children and probably didn't have the issue at that time, and she assumes that this pregnancy too, she will go elsewhere to somebody who is not an expert to manage her, or she's just self-medicating or managing herself, which is very dangerous. You can imagine her having gestational diabetes. First and foremost, she would not even know, because she hasn't checked. You would only know what you have investigated. And then secondly, all the right treatments or managements will not be put in place because she is not even aware of what condition she has. So she will suddenly give birth to a child probably with congenital anomalies, a child who is bigger than usual. And if she hasn't done a scan, because it's amazing how people trivialize their health and don't prioritize their health.
Exactly.
You'll just find out that at the point of birth, she's having difficulty giving birth.
And you will not be able to place.
And because the child is too big, you know, because of the diabetes, the child is macrosomic, very, very huge baby. And the child may also have complications. We have birth injuries. You can find out because maybe some inexperienced midwives or some traditional, or I don't know, some people who are not specialists, the people taking the delivery, they can actually fracture the clavicle of the child. The child can have Erb's palsy. You can actually injure the child and give the child some deformities which would have been preventable if she had been in a hospital setting, because they would have foreseen all these things and would have put things in place at least to curb the complications from arising. So it's very essential that you're coming to the hospital is not just to keep the hospital business running or for doctors to collect your money.
Yes.
It is for your own safety and the safety of your unborn child.
All right, all right. So, Dr. Rebecca, I would just love to ask you this question before we move. How important is family support in managing all right? So, Dr. Charles, I'd love to ask you, how important is family support in managing diabetics? You know, people with diabetics also have families and they might be going through a whole lot. So what's your advice to these people? How do they manage the situation with their family members?
Just like any other illness, illness requires you doing the right things in terms of presenting early to a medical professional, you know, sticking to your treatment regimen that has been recommended for you. And also, we all need good support. We need a support system.
Yes.
You know, people that would support us emotionally, people that would support us when we are discouraged, people that would, you know, cheer us on, even when we don't feel like doing the things we're supposed to do, because these are the people that will serve as reminders for us. So family support is key. For instance, somebody who is managing diabetes, occasionally, being a human, the cravings come, you want to eat what you're not supposed to eat. Somebody comes and gently reminds you, you're not supposed to eat that. Remember what the doctor said.
Yes,
this is not for
we
you.
to have our backs.
Exactly. And then somebody tells you, the doctor asked you to always exercise. You've not exercised in the last 2 days. I think you are missing out on something important. Let me go on a walk with you, just to encourage you, just to give you that drive and that motivation. Somebody reminds you, have you taken your medication today? And somebody reminds you, your hospital appointment is on Friday. I hope that is in plan. You need all this.
Yes.
It is when you have this support that you can actually do well, and it sends a message to the patient themselves that they are wanted. Exactly, they are wanted, they are loved. They don't want to lose them.
Yeah, it's
and
not
everybody,
a death sentence.
Yes, and they matter to the people around them, and the people around them really want them around for longer. And you don't know, you cannot quantify what positive effects it will have on the well-being of that patient.
Yeah.
You know, so it's important that family members, you know, rally around people living with diabetes and give them all the support.
All right,
they
thank you
need.
very much. So in 30 seconds, just tell us one advice for people that are ignoring these symptoms and should really, really pay attention to their health, just to, you know, bring that awareness to them.
Well, for people that have the symptoms already and they're not paying attention to it, or they're ignoring the symptoms or wishing away the symptoms, they're treading on dangerous grounds, because what is going to happen certainly is you're going to just find out that there's kidney failure, you lose your vision, you know, you may have erectile dysfunction, you have wounds that won't heal, you are playing with complications that are too detrimental for you to ignore. Because at the end of the day, when these things happen, you will go back to the hospital you have always been avoiding, and you will go back to the doctors you've been running away from. And then, mind you, to manage complications, mind you, I use the word manage. So manage the complications is way, way, way more expensive than you managing it at the diabetic stage before those complications arise. So it's better you choose how you want to spend your money, and you better choose it wisely. So better make the choice to handle something when it is still very minor and when things are not complex yet, than for you to be running around looking for dialysis or transplants when the kidneys have already gone bad. So please don't ignore your symptoms. Your symptoms are red flags that your body is sending to you. Do something about it.
Okay, please don't ignore your symptoms. We've heard that from the medical experts on the show today. So a very, very big thank you to Dr. Rebecca Markley and Dr. Charles Adiogun for sharing such clear, practical insights with us today. Thank you very much, Dr.
Thanks for having me.
All right, diabetes may be a lifelong condition, but remember, with the right information, early detection, and intentional lifestyle habits, life can remain full, vibrant, and deeply rewarding. So everyone watching, your health is not a burden. It is an investment. Your body speaks, and please don't wait for it to shout before you listen. If you notice any unusual thirst, fatigue, weight changes, anything that doesn't feel normal, please seek medical help early. There is strength, not shame, in taking control of your health. I'm Praise Peters, and this has been Health Check. Until next time, please stay informed, stay intentional, and above all, stay alive.